Unfortunately, in addition to it being spring, it's that time of year where you find the yellow pollen covering your car, you get sneeze attacks, red, itchy eyes, you stick your head out of the door for a second, and you realize that allergies affect over 50 million Americans. And believe it or not, they're the sixth leading cause of chronic illness in the United States. So if you're suffering from allergies, listen to what Dr. Brent Wallis from People's Health has to tell us as he joins us now to share his knowledge on the subject. How you doing, Dr. B?
Hey, Tommy, I'm doing good, except for these allergies.
Do you suffer a lot?
Oh, terribly.
Yeah, it's bad. Do you have oak trees on the property or not?
Yeah, I do. I know, and they're dropping those little squiggles right now.
Whatever they are, them fuzzy things, and they're terrible. And on a side note, I clean the gutter Sundays, and I looked yesterday, Dr. B is saying as though I'd never touched them, and that can be frustrating as well. What exactly is an allergy?
Sure. An allergy is really just the response of your immune system to something you're exposed to. And it can be something that you breathe in, like all the pollen around you, but also dust and mold, too. It can also be something that you eat. Some people have seafood allergies or nut allergies. And then it can also be something that you touch, so something like poison ivy or a poison oak. And so, when you get exposed to something, what happens, that's called an allergen. And when your body is exposed to an allergen, your immune system just kicks into high gear and tries to attack that allergen. And that attack is actually what is the allergic reaction. So it causes things like sneezing and runny noses or even itching, or a rash.
A lot of people seem to complain in the springtime about allergies, but is it only in the spring or is this a year-round type thing?
Yeah, it definitely can be year-round. In fact, there are different things that you get exposed to different times of the year. Right now, obviously, in the spring and then even into the summer, everything is in bloom. Pollen is falling. It's on everything. And so really, pollen allergy sufferers really have a tough time now, probably all the way until it gets real, real hot in August. In the fall, when it starts to cool down just a little bit, everything is dead by that point, and so you start getting ragweed allergies, and those can be very severe as well. And then once you go into the winter, you would think it would stop, but actually in the wintertime, we tend to spend more time indoors, and so people that have indoor allergies to things like dust mites and mold, in particular here in Louisiana, they have terrible problems as well.
Do your allergies change as you age? Could you be allergic to something now that you weren't then?
Yeah, they definitely can, and a lot of people don't realize that. They think if you got through childhood without allergies, you don't have any problems, but they actually can get worse as you get older, and then you can develop a completely new allergy when you're older. One thing we see sometimes is that people move to a new part of the country or sometimes even just a new part of the city, and you get exposed to a different allergen that you hadn't been exposed to before. You can develop a real severe allergy to that allergen. And then, the other thing, we talk about something called lifetime load. Lifetime load is when you are chronically exposed to something, in particular something like dust mites in your house. And at a certain period in your life, when you hit that maximum load that your immune system can handle, you'll just all of a sudden have a pretty severe reaction. So there's a lot of things that can happen over the course of your life that can change your reaction to things. And, genetics actually plays into this as well.
Really? You can inherit allergies?
Yeah, unfortunately. So a lot of people can thank their parents for this, but if you have one parent who's got an allergy to something, there's about a 40% chance that you're going to develop that allergy when you get older. And if both your parents have allergies, there's about a 60% chance that you're going to develop problems.
And to my beloved son, Tommy, I leave my pollen allergy because I never liked him. How do you know how serious your allergies are, Dr. B?
Well, I mean, they're miserable no matter how serious they are. If you suffer from them, you definitely know. But we classify allergies, we really classify them into two major types, either intermittent or persistent. So intermittent allergies are people that have usually, one or two allergens that affect them. They usually only have symptoms about four days a week, but definitely not the entire week, and usually for about 4 consecutive weeks in a row. Persistent allergies, which are very common down here in New Orleans, that's where you really have allergies all the time, more than 4 days a week and definitely more than 4 consecutive weeks. And then we do grade the symptoms as well, either mild, moderate, or severe. So, if you've got real mild symptoms, it's really not affecting your daily life. You're able to sleep okay, maybe just a little bit of coughing, runny nose, or a sore throat. But if you have a really moderate or severe problem with certain allergens, it really can cause major problems. You can have difficulty sleeping. A lot of people snore, so when you wake up, you don't feel rested. You may try to avoid doing, things that you really enjoy because you just can't tolerate it. You can develop a chronic cough or really severe rashes and hives. So it can get extremely severe.
Well, when you got that itching in the bottom of the ear, that's when I know it's coming on. We're going to talk about some steps you can take to fight back against the allergies when we come back. Thursday morning, we talked to Dr. B at this time. He's the Chief Medical Officer of People's Health, Dr. Brent Wallis, our friend, and we're going to continue the discussion about allergies and how you can fight back against them when we return right now, 8:20 traffic time, WWL. 8:24 and a half, Tommy Tucker, WWL, Thursday morning, April 7th. We talked to Dr. B, Dr. Brent Wallis, Chief Medical Officer from People's Health on Thursday morning. Try to keep us healthy, especially as it relates to seniors. So, Doc, what can you do to fight back against these allergies and not have to live your life hiding under the we don't want to go under the bed. They got dust mites there. Staying inside, doing whatever. How can you fight back?
Yeah, it may not seem like it, but there are a couple of things you can do to fight back, and really the key is trying to avoid the allergy that triggers you and causes your symptoms. And so for a lot of people, that's dust mites and molds. That's really the most common type of allergen that we see, and you get exposed in your home. And so you want to make sure that you keep your home as clean as possible. In particular, you spend a lot of time in your bed and in your bedroom, so you want to make sure that you've got clean bedding, that you wash your sheets frequently. You can actually use mattress pads or pillow covers to try to prevent some of those dust mites from accumulating. The other thing, too, is carpets. Carpets hold a lot of allergens in them, so ideally, you want to try to get rid of your carpets and install solid flooring, but if you can't, you've got to make sure the carpets are well vacuumed frequently. And the person with allergies, by the way, should not be the one vacuuming. I always tell my wife that. Someone else needs to do the vacuuming, not me. But keeping everything well dusted and dry as well is really important, so running the air conditioner can help because otherwise mold may develop. Some people use HEPA filters in their air conditioner, and that definitely can pull some of the allergens out of the air as well. For the people that suffer from a lot of the outdoor allergens like pollen, staying inside definitely does help. You don't want to do it when it's so nice out now, but you may have to if you have a real severe allergy. You don't want to leave your windows open because that's going to just pull that pollen into your house. And it's kind of interesting, during the pandemic when everybody was wearing masks, we actually saw a lower incidence of allergies because people were filtering everything out through the mask. And then, you can talk to your doctor about medications because sometimes we do prescribe antihistamines that can actually help with allergies, but they can interact with other medications, in particular blood pressure medications. So you always want to talk to your doctor before you start taking something over the counter, just in case you're taking something else that it might react to. And those allergy medicines sometimes can cause some symptoms as well, some dizziness or drowsiness. So, again, make sure you know what you're getting into if you start something like that.
I was talking about cleaning the gutters. When I do that, I cut the grass. I got that COVID mask on because it does help keep it out of your lungs and out of your nose and so forth. What can you do for moderate to severe allergies?
Yeah, if you've got real moderate or even severe allergies, you definitely want to talk to your doctor. We can actually run some tests. There are some blood tests as well as skin tests that we can do to really identify what you're specifically allergic to, and that way you can actually try to avoid those triggers. And, we used to do a lot of the pinprick test. We do still do those, but now we've got some easier tests where we put a strip on your skin, and then we can read it 24 hours later and really tell you, what you may be reacting to. And if we identify that item, you can get immunotherapy or what we call allergy shots. And we do still use those. And the way they work is basically we expose you to a very small dose of the allergen that you have a problem with, and then increase that dose over time. So what you're trying to do is desensitize your immune system so that you don't react so violently to it. So again, it's really important to talk to your doctor about what your options are, to talk to them about what medications that may help you as well. And then, one last thing to keep in mind is if you are prescribed a medication, don't stop taking it. You want to talk to your doctor first, because if you're on something and you stop it abruptly, your allergies can really exacerbate and cause a whole lot of problems.
How can people find out more about People's Health, Doctor?
Yeah, they can find out pretty much anything they want, this information and more at our website at peopleshealth.com. Or we invite people to come and visit us at our new People's Health Medicare Center, which is on Veterans Boulevard, right next to Party City at Causeway. You can make an appointment or you can drop in and see us.
And you always call 800-978-9765, and you can follow People's Health on Facebook, Twitter, and Instagram. Doctor, are there people that don't have any allergies at all?
Yeah, there are some people, and more likely it's that they don't have an allergy that they really notice. Most people do have sensitivity to certain things, but there are some very lucky people, I am not one, who really don't have any problems at all.
Man, I'd like to get those genes. Thank you, sir. Have a good week.
Thanks, Tommy. You too.
Dr. Brent Wallis, People's Health. We'll talk to Rafael Goyeneche about violent crime in New Orleans when we come back. Right now, though, it's time for WWL First News, and for that we go to Dave Cohen.